So the research that we're presenting at the American Heart Association this week focuses on cardiovascular risk and minority stress in transgender and gender nonconforming persons. And minority stressors are stressors that are specific to the transgender and gender nonconforming community, which include things like experiences of discrimination or internalized transphobia, which is negative feelings or shame about one's own gender identity. In this study, we were really interested in examining the role of minority stressors on different factors that influence heart health or cardiovascular health in the community. So we looked at minority stress, including discrimination and internalized transphobia. And then we were interested in some health behaviors, including tobacco use, alcohol use, sleep, and physical activity. And what we found was that higher report of discrimination was associated with worse sleep and higher rates of alcohol use among a sample of about 288 transgender and gender nonconforming people living in New York City, Atlanta, and San Francisco. And then we also found that internalized transphobia was associated with lower rates of engaging in physical activity among these individuals. We were particularly interested in looking at some factors that might be protective for cardiovascular health. So we were interested specifically for this study in social support. And what we found was that when we looked at people with high levels of social support, we found that those individuals, even when they experienced discrimination, still actually had better sleep than individuals who had lower rates of social support. And what this study really indicates is that social support might be a protective factor for the cardiovascular health of transgender and gender nonconforming people. And it has particular implications, I think, for a community that can be sometimes marginalized or even rejected by family members. In particular, what we found was that it was social support from family members that was particularly helpful for their cardiovascular health.